Gauteng is fast approaching the 50,000 mark with close to 300 deaths. Now let's discuss the numbers and the surge in cases, and we're joined by the Gauteng Health MEC, Dr. Bandile Masuku. Dr. Masuku, thanks for your time. First, I want to begin with the family that is grieving at this time. It's been 24 hours since the death of Shonisane Letole, who was admitted at the Tembisa hospital. His parents are of the view that he was not given proper care at that hospital. Have you made contact with them?
Yes, good morning, and thank you for having us. Yes, we have made contact with them. Yesterday, a team from my office went there, led by our district director in Ekurhuleni. We did ascertain and give a progress report on what we are going to be doing in terms of investigating and getting to the bottom of what has actually occurred. And this is an unfortunate and a very regrettable situation, but it's important that we follow the due process, get to understand what happened, and also then take further action after that.
Yeah, on the face of it, MEC, are these claims valid that he was not fed, and just the general state of the hospital itself? Are healthcare workers there overwhelmed?
No, I think let's not speculate, about what could have been and what could have not been. I think let's wait for the report that will be done and collated by independent quality assurance people, and then we can have a fair discussion about it, so that we don't speculate and we don't get to a point where we even make some form of accusations and others. So it's important for us to respect the process, and like for an example, on the face value, it is a regrettable situation as it appears, and it's something that we need to correct. One thing that we need to emphasize as the Department of Health and Gauteng government is that we will at all given times be able to account for any of our actions or any of our staff members, and be able to be transparent for that matter.
The reason, MEC, I am pressing you on this matter is that it's not the first time that the Tembisa hospital has been in the news for the wrong reasons. So people are already being skeptical about the treatment that this man received at the hospital. In other words, they are likely to believe that indeed he was treated shabbily.
Yeah, I think that's what the perception is there, and we have never been, we have not denied that we have challenges in many of our facilities, including Tembisa. But remember that part of this process alone is continuously use incidences such as this to improve our services, to make sure that we get to a standard where the public will be pretty much confident with what we dish out as a service.
MEC, let's talk now about the infection rate in Gauteng. As we mentioned in the intro, the province is fast approaching the 50,000 mark in terms of infections, chasing the 300 mark in terms of fatalities. What are your modeling and projections telling you at this time? What are you looking at?
We are looking at that by the end of the weekend would have passed 50,000 and going towards 60. Remember also we have a very big chunk of results that will come in bulk because of the backlog that we have actually wiped out. So that's the reason why you see the numbers going actually quite fast. But again, is that the modeling that we have been using, which continuously changes, had given us an assurance that will pass through June without problems in terms of bed gap. But now in July, there's a prediction that we'll have actually bed capacity issues. Hence, we are putting up measures in that regard.
What about the mortality rate?
The mortality rate is still relatively low as expected. Some of the countries, when they reach the mark of 50,000, the mortality rate would have passed over 1,000 actually deaths. And it's something that we are quite astonished about, but we'll observe and continuously make a very clear commentary on it. But our mortality rate is still relatively low, including hospitalization in that regard.
What is astonishing about it, MEC? Were you expecting a much larger number than what your projections are telling you?
Yes, if you look at countries like Pakistan, who have almost similar numbers in terms of our infection, they've already passed, almost 400 or 500 deaths in their thing. So it's also something that we are looking at to measure it properly. That our mortality rate still remains quite low in that regard. So countries who have passed 50,000 mark have already passed, 1,000 in terms of, actually death in that regard.
MEC, let's get you on the record now on this intermittent lockdown that you have suggested. Last night on this channel, we spoke to Dr. Abdul Karim, and he's of the view that if the lockdown, the hard lockdown, is implemented again but done carefully, it's something that definitely is to be looked into. Have you started implementing it in some hotspots?
Not really. Remember that the decision to implement lockdowns are decisions that are taken by the National Command Council, which we are awaiting the meeting that it's sitting over the weekend. But one of the important things about the options is that we are now going into any lockdown within the parameters of insights that we have learned from our previous experience now on lockdown. So meaning that we will be able to implement it effectively and we'll be able to come up with maximum benefits from it.
How soon can it be expected? I know I'm asking you to speculate here, but how soon can citizens expect that intermittent lockdown, and which areas I think is important, MEC, because people are going to be panicked that they are going to again be restricted in their homes?
Yeah, I think let's clarify it this way, actually, that intermittent lockdown is an option, on how we are going to apply a lockdown. And the National Command Council can decide to take another decision and on how we can implement it. So the whole matter will be about how we mitigate the risk and also how we protect the system, and more importantly, how we protect our healthcare workers. Because I think for the June period that we have been through, we also need to give the system a breather and also give our healthcare workers time to refresh and be able to be prepared for the next coming round of a spate of infection. So it's an important aspect of imposing very stringent, restrictive regulations, which will help us in a way to reduce the rate of the spread.
Final question to you, MEC. You touch on the issue of healthcare workers, very, very important in your fight against the spread of this virus. How worst affected are they, and where are your most urgent areas right now where they need much closer attention?
Our hospitals, all of them require more help in terms of more hands on deck. And the Human Resource Department, has been dealing with it, continuously hiring and also contracting healthcare workers. It's an important aspect in the strategy that we have been actually developing, that we need to be able to replenish the ones that are here. Because besides being fatigued, besides being burnt out, we are going to be seeing a lot of people who would be infected in that regard. So it's important to have a continuous circulation and rotation of staff and hands on deck in that regard. Very,
very briefly, MEC, I am out of time, but I've got to put this to you. The quarantine facilities, isolation facilities that are provided by government, are people taking those up? Because lessons learned from the Western Cape, people there have been reluctant to do so.
The numbers are they're growing quite fast in our quarantine facilities. We are visiting one this morning, the one in Nasrec, which have started mid-June to actually function. At the current moment, I think we are close to 150 people who are there. And most of these 150 people are people who called themselves requiring actual isolation and quarantining. So it's quite encouraging that we are starting to see people also in their own voluntary coming out to say they want to be isolated, because in most instances we had to even insist and go to court for such to happen.
MEC Bandile Masuku is the health MEC here in Gauteng. Thank you very much for your time.